This patient came to me, she's one of my maintenance patients, and for some reason she decided to have an implant placed in a different office. You know, we're not mad about that or anything, but she did come back and she was experiencing some pain and tenderness and swelling and some pus that was coming out of the area of the implant. So she wanted to go through her treatment options, and the options were either to remove the implant as it was and regenerate the area and see if we could, see if we would treat the area that way and redo basically from scratch, or I presented her the option of treating it with the laser and seeing if we could possibly regenerate some bone around this implant and save it as it was. So she elected obviously to try to save the implant, and we did a one laser treatment, 10 minutes. She came back 2 weeks later, the swelling was gone, the area was not bleeding anymore, there was no pus coming out of the area, and that was great. But even better was when she came back 6 months later and we took an x-ray of the area and we saw bone regeneration. Not all the way up to the top yet, but definite signs of bone regeneration. And then she came back for another recall visit 6 months later, and we took another x-ray and we saw even more bone growth in the area. And obviously the patient is ecstatic because we were able to save her implant, minimal time and minimal effort and minimal cost, as opposed to the other treatment option, which would have been more time consuming and not as cost effective. And we're both looking forward to seeing each other in another 6 months when we can take a new x-ray and see what's going on.